Thank you so much, Sandro, and everyone. I'm so sorry I couldn't be there in person. Yeah, very keen to get over to Korea in 2026 and meet with you all. And absolutely no problem to join so early from London. I have a toddler that gets us up around 5, so no problem. Sandra's already preempted this a little bit, but I did just want to give a couple of very brief slides on who Welcome is, because I'm conscious that particularly in this space, we've really started to move more into working on AI and advanced analytics. We're not as well known as some of the other foundations. Apologies. So just wanted to share with you all that we are, as Sandra said, one of the biggest independent global foundations. I think our independence is actually what makes us really unique. Everyone knows this very well for our funding programs, for research teams and programs, but we also do a lot of work on global partnerships and advocacy campaigns, and I'm going to highlight some of our work in the AI field throughout this presentation. Also, just thought important to share objectives for 25-26 with you all, and in particular the third one. My team does a lot of work in the African continent and some in South Asia, Southeast Asia, and that's really something over the next year we want to work to build and foster stronger relationships and collaborations. So this is a little bit of who we are on a high level, and our teams sort of work into these verticals of discovery, research, infectious disease, climate and health, and mental health. But these aren't silos of working. There's obviously a lot of overlap between them. You know, we've done a lot of research looking at the impact of extreme heat and mental health, also of extreme heat and pregnancy, also thinking about climate sensitive infectious diseases. So although we do have these priority areas, there's also a very big Venn diagram of how they all interplay with each other. And our team, the Data for Science and Health team, very much sits in the middle to cut across all of these priority areas. We work very deeply with each one, as well as focusing on some core foundational infrastructure, capacity building, tools and software, really just trying to make sure that our investments are supporting a kind of across the AI sphere, as well as doing that dedicated work for domains of science. So just very briefly on our AI strategy, I'm going to talk a bit more about our work and some of the challenges that we've been facing and some of the things that we're thinking about. I think that's maybe a little bit more interesting. But just to say that the kind of three pillars of the work that we've commenced in the last year or less than a year are under AI for scientific breakthroughs. So really just trying to think about how we can make big bets on data sets or benchmarking suites or things that are really going to shift the needle on science and AI for science. They're not thinking about meta science. So really for us, we fund researchers. We do a lot of clinical work as well, don't get me wrong, but trying to think about how we can leverage AI to make research more efficient and more equitable. And the last one then is about sort of responsible AI in healthcare. And this is one of our big flagship programs that I'm leading on with the team. Talk about a little bit more, but that's really thinking about how we can move models out of computers and into health systems, and how we can do that in a way that's evidence-based and rigorous, but also adaptable for local context. So I'm just going to talk very briefly about some of our initiatives. It'll be a bit of a whistle-stop tour, really just trying to highlight some of the issues and areas that we're thinking about, like I said, and it's great to act, as much as it's a hard act to follow, going after Lorenzo and Fred, they've both mentioned some of the same things that I think we're grappling with too, so hopefully that will help tie some of those threads together. So just starting at the start of the AI lifecycle, because I think that maybe makes sense, we've done a lot of thinking around data set development for machine learning, and particularly about focusing this in LMICs and making sure that we're trying to drive equity. I'm sure it's no surprise to people in the room that there's a lot of issues with, global north data sets being used to develop models and not always being translated over to other settings in the right way. We've therefore had some very directed funding, seed funding really, for a lot of big programs now several years later to try and develop a lot of data sets that are bringing together data from clinical systems, from social care, from community-led health initiatives that are really leading the way in other parts of the world, and trying to then have these in a state that means that they can be utilized by researchers across the globe to try and diversify some of the underpinning data for machine learning models. One thing that we are really grappling with, though, is that, yes, while it's great to fund these data sets, and we've seen some fantastic things happening from these data sets, there's also then an issue where local teams developing them don't always have the analytical capabilities or the compute power resources to actually leverage those data sets to their full potential. And we're seeing, again, some of this global north researchers coming in, leveraging data sets, not always being able to then give tools back to the teams that have really worked so hard to create those foundations. So we're really trying to think about, okay, well, how do we support data set development in a way that also provides some of that analytical capability and resources, and how do we collaborate with the system to make sure that we're doing that in an equitable manner. Then thinking about model development, one of our big programs has been this Data Science Without Borders initiative. This has only at the moment been focused on the African continent. We've focused on 3 pathfinders really to try and get the model off the ground. And it's been an absolutely incredible program, and real credit to the team at the African Population Health Research Centre for that. And what this has tried to do is assess digital maturity at different parts of the continent in organizations with kind of very differing digital capability and knowledge at the start, trying to then understand how we can level up, how we can create standards for data extraction and transformation, and then have enough standardization while, of course, speaking to kind of local need and context that allows us to put an open source analytical platform on top of the data stores in each of these countries. The program has instituted one of the first federated analysis capabilities on the continent, and really what we're trying to do now is look at how we can have some collaborative AI development and really also deal with things like data disparity through techniques such as transfer learning. That was really the driver for a lot of this work, is that we had countries say to us, we have a little bit of data on dengue, one of our neighbors has lots of data, can we use theirs and ours together? What are the kind of limitations and issues with that? So trying to think about how we can get teams to work more collaboratively together and deal with some of the lack of data digitization that we might be facing, as well as looking at how we can leverage more green machine learning approaches, small models that deal with some of the issues with compute resource access, etc. And I think it's been a fantastic first couple of years for this program, and really trying to think about how we scale now wider in the continent and beyond. And they've really done a lot of work to identify how we can set up that end-to-end AI pipeline, leveraging federation capabilities. A really big focus on sandbox is something that we're doing a lot of at Welcome, and also thinking about how we can partner and have the right local leadership and capacity building. So like I said, with some of our work in AI strategy, we also want to think about how we can actually get models into health systems. We want to think about how we can make sure that tools are evaluated with enough rigor, that there's the confidence in their procurement and adoption at a national level, while also making sure that we're not trying to put traditional, academic approaches on tools that just don't work for traditional evaluation, RCTs, etc. So this is a collaborative effort with the Gates Foundation, Novo Nordisk Foundation, really focusing in on cost-effective analysis, implementation science, as well as, of course, looking at interplay with model efficacy. We're doing our first funding call in Q1 2026. I'm really focused on primary and community healthcare and AI tools that can leverage in those spaces, but also then really thinking about how we can make sure that all of the learnings of this evaluation can be sensibly synthesized so they can support health technology assessment frameworks, regulatory science frameworks, and also recognizing that as a team predominantly sitting in London, we definitely shouldn't be doing a lot of that research and policy translation ourselves. So we've identified partners in these regions, currently getting the paperwork together, which is why I can't speak to exactly who they are, but really happy to share that and any other future press releases in the coming months with you all. But yeah, making sure that we've got the right regional leadership and capacity building in place for convening and knowledge synthesis, and that everything is really being played back to the context that these tools are supposed to be operating in, and really making sure that at the kind of end impact, and coming back to one of our objectives for the year of really centering impact, is thinking about how we can make sure that the innovations that are being supported and tested are also ones that are being locally developed, that we're not translating or transplanting innovations from the global north into the global south, and really fostering south-to-south collaboration as well. So I think the kind of big things that we're thinking about are about the implementation routes. There's lots of questions about the hardware and compute and AI integration engines that are going to be needed in order to make this successful, as well as also thinking about how we can set up these evaluations that work within individual workflows, but that also then tension with what regulators want and need, and particularly those post-market surveillance requirements, and from a safety perspective more than anything. So of course, once we have these tools that have been developed, we then need to think about regulation. There's of course a big regulatory component of the real world evidence platform that I just spoke about, but we're really trying to deep dive onto this in the UK with our own regulator and the National Institute for Clinical Excellence, which set a lot of guidelines within healthcare for the country. A big focus of this has been on their AI airlock, a regulatory sandbox, really thinking about how we can stress test tools in different environments. And because of the kind of nuances of some of the infrastructure we've got in the UK, also thinking about how we can do some of that live monitoring once tools are out into the ecosystem, and thinking about how we can sort of set up some of that post-market surveillance in a live and iterative manner. And there's also a real global focus of this work. Then the team at MHRA are really looking to how we can collaborate with other regulatory bodies, and how we can collaborate with those who are setting those assessment criteria and evidence building activities. And I think a really interesting piece that we're finding here is that not just the MHRA but other regulatory bodies that have a lot of experience and capacity are often being looked at to lead the way, or those countries doing counter checking on their regulatory process that's already been done, because that's going to save time, save capacity. So really thinking about how they can make sure that a lot of their guidance and regulatory approach can be safely utilised in other countries, and it's not only playing to a solely UK context. But obviously, regulation can only go so far, and I think one thing in particular that the team's thinking about is digital mental health tools, and some that target kind of clinical symptoms such as poor sleep, but they don't quite fall under the kind of medical device definition. They don't quite fall under regulatory authority. So there's a question then of how we, and I say we with partners, of course, create some of those reporting mechanisms and expectations of what evidence should be there for the claims that are being made in a way that's acceptable and feasible and isn't stifling innovation. And I think that's something that comes through all of our work, is making sure that we're having a facilitative ecosystem for R&D and AI and digital health tools, while also making sure that we're sticking to our principles of equitable access and openness. The last one to mention, just because I think it is truly the most brilliant work that the team is doing, and that's on evidence synthesis. So this is one of my colleagues who works in the climate and health team, has made a lot of incredible investments into AI-driven living guidelines and evidence synthesis for mental health, and as well as for climate and health, and leading on the evidence synthesis infrastructure collaborative. So her and the team, I definitely would recommend getting in touch if it's something that you're interested in, but really looking at how with other funders we can continue to make sure that there's not a time delay with access to evidence, and the guidelines, like I said, are living and up to date with emerging science in the field, particularly for something like climate change, where there's a lot of advancements happening very rapidly. And then we as funders need to think about, well, this is what we're seeing in that evidence into the space. Where are the gaps? These are very dynamic research landscapes. How can we intervene in the right way to make sure that we're advancing science and working for the rest of the ecosystem? So that was a very whistle-stop tour of a couple of our big initiatives. There are plenty more I could have spoken about, but hopefully gives you guys an idea of who Wellcome is and what we're working on, and any sort of areas of synthesis and collaboration. Thank you.